I'm Vasili Karas, and along with my dedicated team, I'd like to welcome you to our practice and to Midwest Orthopedics at Rush. Whether you are at the end stages of arthritis and need surgery, or are working towards optimizing your musculoskeletal health and longevity, our commitment is to help you overcome your present limitations and to live your personal best for years to come. Through research and development, and humbly learning from my predecessors, I've designed a surgical workflow that combines rapid recovery, a minimally invasive approach to surgery, and the accuracy and personalization that is only possible with the latest technology. Before we even make it to the operating room, we consider the specific type of movement and requirements on the body activities that are important to the patient have. In every hip replacement that I perform, I obtain a CT scan and several x-rays of the patient in different positions, then virtually replace their hip. I then drive the model through a battery of movements in a virtual environment and test movements specific to their desired activities to ensure the implants are perfectly placed within their bone, muscles are tensioned optimally, and the length of their legs and other proportions are accurately restored. Traditionally, much of this planning is done when the patient is asleep on the table during the operation, without the benefit of a virtual model. My technique affords us the opportunity to dial in our plan well before you are anesthetized, so we can really be thoughtful and focused on optimizing each hip replacement to each patient's unique characteristics. Once the personalized plan is complete, it's time for surgery. The surgery itself is completed through a robotic-enabled STAR approach. I'll break this down for the curious. Let's start with the robot. This technology allows me to do two things that have never been possible, and both lead to less muscle and bone damage and a more personalized surgery. The robotic system allows me to virtually see every detail of your bone, whether I can with the naked eye or not, while performing your surgery. This helps me avoid the larger incision and tissue damage that is traditionally needed to be able to perform hip replacement. In addition to seeing these details, the second benefit is that the robotic arm we use enables us to size and place the needed implants within 0.1 millimeters of accuracy. This is a level of precision impossible with traditional techniques. In addition to robotics enabling minimally invasive surgery and personalized implant placement, the STAR approach combines muscle-sparing nature of the traditional anterior approach and the safety of the traditional posterior approach to the hip. It is one of those rare instances where we can have the best of both worlds. The STAR approach uses a more posterior-based skin incision that avoids nerve damage and wound healing issues that are present in up to 30% of direct anterior surgeries, placing the incision along the easy-to-heal and more hidden dimple between the hip pointer and the buttock. Once through the skin, the STAR approach is muscle-sparing, namely sparing the abductor muscles, avoiding the large quadriceps muscles, and sparing the piriformis muscle completely. I'm very confident that this approach is the latest and most advanced approach available because it is the best combination of the safety benefits of the traditional posterior approach and is muscle-sparing, providing a rapid recovery like the traditional anterior approach. My hope and expectation is that with a personalized plan, robotic-enabled STAR approach, and a committed team as your refuge during your surgical experience, your new hip will carry you through your best years yet.